name's Dr. Kevin Baumlin. I'm running for U.S. Senate in Pennsylvania. Why, you may ask? Good question. I'm a doctor, I'm a leader, and I'm an innovator. This pandemic really changed me. I'm a frontline provider. I run an emergency department in Pennsylvania, 45,000 patients a year in an urgent care center. We care for people. That's what I've dedicated 30 years of my life to, is caring for people. I work on the front lines with my team through this pandemic. It's been an extraordinary, life-changing experience. I'm an emergency physician, so we have a tendency to tell stories about our patients. So here I go, patient number one, Mr. O. I knew Mr. O for only 4 hours. He was a Hispanic gentleman. He's 81 years old. Excuse me. History of hypertension and heart disease. And I talked to him when he arrived. I was speaking with him about what mattered in his life. He had 5 kids. His kids were the most important thing in his life. We talked about his advanced directives, meaning whether he wanted to be intubated if it came to that. And he said, nope, if it comes to that, I want to go with God. I remember him like it was yesterday, because only 4 hours later he died. I was holding his hand. And my nurse was on the other side, and one of his 5 daughters was at the head of the bed, touched his face, and said goodbye to her mom. Things like that change you. I found myself in the next room crying for a good 10 minutes, trying to pull myself together. And situations like that, and why we are here where we are in this particular pandemic, we had 620,000 lives lost, 28,000 in this state alone. 28,000. I just looked it up yesterday because I keep saying 25, and I thought, I bet you it's more than that. Another 3,000 lives just in the last couple of months. Why? Why do we have a healthcare system that doesn't take care of older adults in particular? That's my area of expertise. Why don't we have home care for people who are in need? That's part of your Medicare benefits. I see a nod in the room. At least 4 to 5 hours is part of your benefits, so that when you need a little help, you can have a little help at home. That seems like what's something reasonable that we can do. Why do we have jobs that pay less than $15 an hour? I think of another woman I took care of during the pandemic. She worked in West Philly, taking care of older adults. She's an aide. She worked 2 jobs and another side job. I diagnosed her with COVID. She had a temp of 102. She had a saturation of 92. It was too low. She needed to stay in the hospital. She had pneumonia on both sides. I said, I'm going to work. I said, you're going where? She said, going to work. What do you do? I take care of older adults. I said, here's some masks, here's some gloves, here's some goggles we have too. I want you to gown up, everything. Please protect yourself and your patients if you have to go. Why did she have to go? She has 2 kids at home, and she's the only person who takes care of those 2 kids. She makes $10 an hour. She has to work 2 jobs. And God forbid what happens to her if she gets something wrong, like my bill from the ER, and she gets a huge deductible for the services. $9,000 deductible. Can you imagine making $45,000 a year and having a $9,000 deductible? That's 20% of your annual income. That's not okay. We have to fix that. So that's the employer-based system. Also, Penny, the exchanges, we need to fix them too and get low-cost insurance. You pay 1 fee per month, and that's it. You don't have to worry about it. I don't say Medicare for all because I want to fix Medicare. I want to fix employer-based insurance. I want to fix the exchanges, and I want to maintain Medicaid and state-based services so that people who can't make it, we continue to take care of them. Lastly, some of the problems we see in the ER: homelessness, the opioid crisis, food insecurity. Those are some things I talk about, some of the things I work on. The opioid crisis reminds me of a story of a gentleman, 23 years old, strapping kid, out on the street, Mark Street in Philadelphia. Luckily, a police officer came by and he had nasal Narcan. I have some in the bus if anyone's interested, actually. He squirted in his nose and he started breathing again. Just a couple. They did CPR. They brought him into me. Continued CPR. I intubated him. He was 82 degrees. 82. After quite a bit of time, we got him back. I got him up to the ICU. And you know what? He's on Suboxone. That's the treatment for people who have opioid addiction. And he has a job. And he has a place to live. And you know what? That kid, he's not a criminal. He's a kid who had an addiction. And we needed to treat that addiction and help him That's what we need to do. Treat people with addictions, not incarcerate them. It doesn't help. The war on drugs does not help. It has not helped. So let's stop doing it. It doesn't work. Not another $2 trillion, not another dime. Stop incarceration. Let's get treatment. So I'm Kevin Baumlin, and I'm running for U.S. Senate.